Jonathan D. Stewart here, and I'm broadcasting live from Kent State University today. I'm joined by a set of 3 nurses in the nursing program. Would you care to introduce yourself?
I'm Courtney Hudson. I will be graduating from Kent in a week from now, and I have a pediatric ICU job after graduation.
And I'm Deiwert. I will also be graduating in a week, and I'm a med-surg nurse after graduation.
I'm also graduating in a week. My name is Kaitlyn Kauppila, and I have a med-surg job after graduation.
That's excellent. Awesome. I'm just very happy to have you ladies here today. Thanks for joining me and everything.
Thanks for having us.
I've been really looking forward to this. So I want to get started by asking, like, how was it getting into the program?
I would say that getting in was one of the most stressful times, just because they stressed you, like, you have to get, like, all A's to get in and everything like that. But looking back, it wasn't too bad now.
Yeah, it was really stressful in the beginning because you had to have really good grades, almost a 4.0 type of thing to get in. Because the first year of our Kent State program is pre-nursing, and then you apply to get into the program. So that's the main goal. But yeah, it was tough.
Was that like a super hard process of like applying to the program, or did you?
Applying wasn't hard. No, it was just the classes, because like you said, we had a full year of like prereqs just to get in the program. So all these classes were like we had to do well to get in the program.
Okay.
Yeah.
Wow, yeah, I know you ladies really worked hard for this and everything. Do you have any input, Katie?
I just feel like starting out in college, that was like hard to learn how to study correctly, and we had to basically get all A's, so like figuring out along the way was hard in the beginning.
Did it take a long time to kind of figure out how to study correctly, or?
Yes.
For me it did, yeah, I did.
Do you have like any personal stories about it? Like,
I think you just have to learn how you study best. Like, I'll make a ton of flashcards and go through that, and like that helps me. And also studying in groups. Like, some people, like if you make friends that are in the nursing program, like they are good study partners too. I like that.
Like first semester I studied alone all the time, and then I met Courtney. Second semester we started like studying out loud, and like that was really beneficial for me.
No, I'm the opposite. I like to study by myself.
Okay.
Yeah. And then I rewrite my notes. That's what I do.
Okay. Any strategies for you? Any different strategies? So you rewrite your notes. What do you find yourself
I
doing?
like doing flashcards a lot. Like a ton of
I do
those.
both.
So yeah.
Any advice for anybody looking to kind of join like the nursing program? Any tips to kind of stay focused and everything?
Well, I think it is like figuring out how you do best, and just to keep focused and like not get discouraged. I think you feel so stressed sometimes and be like, oh, I just like I don't even want to do this, but like it's remembering like the big picture of everything and being like, this is why I'm doing this, and it's not impossible. So many nurses have done it before, so it's really okay. It's just getting through it on a personal level, I think.
Yeah, I agree with that. Yeah.
Okay. So I've heard it's very challenging. Like, what was the biggest challenge you kind of endured in being in the nursing program?
We talked about this earlier, but like time management was probably my biggest thing.
Okay.
And like learning how to balance our lives like socially and with school, because like it is really hard. You do have to study a ton, but you don't want to get burnt out from studying too much. I would say that was hard to learn.
Yeah, time management is such a big thing. Like, we even learned about it in school about time management.
Oh, really?
So, is
there like a class for it, or is it?
Kind of, it's like in our leadership class to like understand the flow of things and how to actually manage time as a nurse. But I mean,
yeah, and it's something we learned throughout the years. Like, I was not good at it freshman or sophomore year. It was very like gradual. Like, I learned, okay, well, if I study this amount, then I should like take some time to like relax for myself, kind of thing. And we learned how to study.
Yeah. I also think we learned what to actually study. In the beginning, we'd study everything really in depth, and there's certain things I feel like I've learned, hey, this is a more important topic than this, and like this is what I should focus on, So I think that's helped a lot. Cut back on studying time so that you have more time for personal time.
Okay. Do you believe that like everything you learned is going to carry over to your actual nursing career once you start in about a week or so?
Definitely not.
No, I
Not
don't
everything?
think so.
A lot of the like math that we were told we have to do, we probably will never, like a lot of the stuff that we learn, we now do like on a computer in school, or in like the nursing world, so
like the information that's very specific to a specific specialty, you're probably not going to need to know that if you're not in that specialty.
Yes.
Okay.
Right. Like I won't need to know ped stuff, and I'll be geriatric, so
that's like different information.
Yeah.
Okay.
Based on like your patient population, I feel like.
Cool. So what was your excitement of like getting into the program and then getting your job after you like finished up? Like, was it a matched excitement level, or were you just like?
I think, okay, the getting into the program, both things were very stressful beforehand. Like, getting into the program, obviously beforehand, we were all super stressed out, and then I think it was more stressful looking for a job, personally. And then, like, when you get the job that you wanted, I think that was also more exciting than the.
Do you think it's like challenging? I know nursing is such a big field and everything, but do you think it's challenging to kind of find a job in nursing, or is it not at all?
If you want a specific job and you have it in your mind, I think that's kind of challenging. But yeah,
I didn't feel that because I wanted a med-surg job, and those are everywhere and everything. So I wasn't stressing about that. But yeah, definitely super exciting to be like, wow, this is what I'm going into. Especially now that we're a week away from graduation, it's like, whoa, we're doing this.
This is real.
Like, this is about to be really real, really fast.
It's very relieving too. Like once you got the job, and like, I mean, we had signed our jobs a while ago now, so like the rest of the school year like didn't seem as stressful, or like anything didn't seem as stressful because like you already landed a job. So that was exciting and relieving.
I've heard a lot about the flexibility of nursing and everything. Do you think it's going to be like your schedule's going to be kind of similar as when you were in nursing school, or is it going to be kind of like drastically different? Are you going to do like part-time, full-time, or is it going to be like did you decide on that?
So you're all full-time.
Yeah.
Employees, but the thing with nursing is that we are working 3 12-hour shifts. So we'll have the other 4 days off, which I think is going to be very different for us because now we're in school full-time and we have jobs and we have clinicals. So like we are constantly busy all the time, and that'll be, I think, at least for me, that'll be a big change. Especially I'm working night shifts, so I'll be home every day, whether I'm supposed to be sleeping or not, but like it'll be different. I think we'll have a lot more free time. I don't know if I'll know what to do with it.
That's what nurses always say, that like after you get out of school and you get your first job and be like, I have so much free time, like what am I even supposed to do?
Yeah.
So yeah, I'm so looking forward to having 4 days off.
Oh my gosh, yes.
Like,
how about you, Kaitlyn?
Even when we would come back from like winter break and we'd have like a week of like no studying, we would all be like lost. We'd be like, what do we do with all this free time? So it'll definitely be different.
It's exciting though.
Yeah.
That is exciting. Wow. So like what's your perspective on like different types of nursing and everything? Do you have anything that you like favor? Of course, I think you all got your dream jobs right away, but is there anything you don't like about like nursing?
So everyone told me going into nursing school, like you're gonna change what you want to do a few times, or like you need to be more open, and that is very true. Like going into nursing school, like I said, I didn't want to do adults at all, but I actually really like working with adults, and like I like all the populations I think I've worked with. There's not one that I hate. So, and like I would have not been able to say that freshman year, like I would have been more hesitant for like the geriatric population, like just me in general, but I like it, so.
So you kind of feel like it like opens up?
Yeah,
like,
you just got to keep your
more
options.
different possibilities of,
For sure.
Okay.
I actually got my practicum on a psych floor, so that's the 36 hours a week with a nurse, and I did not think I would like psych nursing at all, but I loved it. Like it's something I would consider doing in the future for sure.
Okay.
So
That's how I felt. I really liked psych. Like I knew I've always liked old people, so like geriatric stuff I knew I'd like, but I really like psych too. It's interesting what you find that you do like, and then like I didn't really like peds that much, but I still valued it as like an experience, you know.
So do you see yourself like kind of staying in the med surg and the pediatrics field, or do you feel yourself growing and blossoming? Because I know we're still at a very, very young age and everything, we still got a lot to decide. So do you think you're going to be like doing it for like maybe like 5-10 years and then moving to something else and discovering something else, or do you think within the field of nursing, of course?
Right. Well, I feel like that's like the best part of nursing, is that you can switch in between things. I think all of us want to go on to be advanced practice nurses. So I will probably go adult meds or adult geriatric for my NP, but yeah, I'm just moving on.
So you're gonna advance your degree? I'm not very familiar with nursing. So you're gonna like work towards getting a like master's or PhD in the future?
So now, I think they always recommended taking like 1 or 2 years and working on the floor as a nurse, which is pretty much what we're all gonna do.
Okay.
And then you can go get your master's, you can get your doctorate, it depends on what you want to do. Like in my mind, I might want to be an NP, but I also might want to be like a nurse educator is cool too. So that's like a different route, but still like with a master's program involved.
When you're like a nurse educator, can you maintain a job in the hospital?
Yeah. Yeah,
okay.
You can. There's a bunch of different routes. I knew someone that was a nurse educator and like she loved her job and she was like explaining it what she did. And then you can also like become professors at like which I think is cool. Like clinical instructors. There's, like you said, so much growth in nursing, which is nice.
It's like, it feels like it's like endless and like you can do like whatever you want with nursing. Is like so broad and everything. So do you have any recommendations for like people pursuing it? Do you have to pursue like a 4-year degree or 6-year degree, or how long does it take to become a nurse exactly?
If you want your bachelor's, it's 4 years.
Okay.
There are associate degree nurses, so that'd be a 2-year. But I think as time moves on, people prefer hiring BSNs.
Okay.
Just because, you know, the stats behind all that kind of stuff. But yeah, and then any advanced practice usually takes another additional 2 years if you do it full time. And then doctorate another couple of years on top of that.
So there's like an option for like part-time
Yeah, absolutely. Because a lot of the people that you got to think they're working, so having the option to be, you know, part-time is helpful while you're still actually actively working as a nurse.
Okay.
So.
And your job a lot of the times will give you like tuition reimbursement. They'll help pay for it if you continue to work there too.
Wow.
So you can take as long as you want. I've known people to take a long time to finish their doctorate or their master's, but their company is paying for it or helping them out a ton.
Okay.
So.
And if you already have a degree not in nursing, there's an accelerated program. So is that 2 years, I think, full time?
Yep.
And you can become an RN.
Okay, so you said somebody with like another degree,
Yeah,
you have
like
to have like a science degree, or
no,
it could be
any college degree, I think, right? Yeah, and if you want to become a nurse, Kent State's is a 2-year accelerated program. Yeah.
Yeah, I heard great things about like the Kent State program and everything. I'm glad to have you ladies here to kind of talk about it and everything. Was there any like challenges or anything you found like extremely like invigorating in the program with Kent State and everything? Like, did you see anything kind of different from other programs?
I feel like with our program, though, sometimes they seem to like stack the hard courses like together. Like our junior year, first semester was all 3 of the classes we were in were like the most challenging courses in the whole program, which made it made that semester super stressful. But I mean, we did learn a ton. But I think that's where other programs seem to have like, because that was our adults course, split up between different times and stuff like that.
Okay.
Kent State also has a lot of online classes and built into the nursing program. Like as a junior year, second semester, we were not even in class at all. It was just all online. So I guess that's better than depending on your personality.
Was that still like time consuming, or did that free up your schedule a little bit more?
It was, but it's more flexible because you can like listen to the lectures when you have free time.
Okay.
If you're up at midnight, you can listen to it then.
So there wasn't like a set time you had to be in class, like Wednesday or something, 1 to 3?
No, it was only clinical.
Time.
Yeah.
Okay.
And then like every week you had lectures you're supposed to listen to. But I mean, you could wait until the week before the exam and listen to them if you needed to do that for your schedule. Like it was very flexible.
Yeah.
Okay.
So that was good.
So I enjoyed that part of it.
I also liked, honestly, looking back, like I liked what rotations we did because we just finished critical care, like ICU stuff right now, and I think that kind of helped me remember a lot of things, and that, you know, gives you an overview back of all the body systems and that kind of stuff. So right before we take our NCLEX, I think that was nice to have. But yeah, I liked everything how it was set up in general.
I would have never wanted to take critical care any earlier than what we did,
Right.
because it is stressful. Like, I mean, obviously we're in the ICU, like these are the worst, like the sickest patients there are. And like if they would have thrown us in there like sophomore year, like I would not have liked that. So I think the timing is good.
Wow. That sounds very, very intense. I'm sitting here, I'm listening, I'm like, wow. So you think it's a doable like feat to kind of get through the nursing program, or is it kind of like impossible?
No, it's doable.
It's doable?
You have to put the work in, but it's definitely doable.
Okay.
We all survive.
Yeah.
Awesome. So like, what's an average day of like a nursing student? Like, what can you look forward to? Like on maybe like a Monday or Wednesday or something, whenever you have like classes and clinicals. Do you have classes and clinicals matched on the same day sometimes?
Not on the same day.
Not on the same day?
Because clinicals are 10. Oh yeah, they're like 10 hours long.
Okay.
There was one clinical that was 12 hours long, so it's a full day thing. And like that was, I think the first round of clinicals was like really scary.
Yeah.
Honest. Like I was scared. But
Okay.
now with how many clinicals we've done in our practicum, I mean the amount of hours we put in the hospital is like a lot. I think we all feel so much more comfortable about that.
So you feel like Kent kind of prepared you really, really well to kind of be in that environment and everything?
Yes.
Like right off rip, or did it take time to kind of?
No, it definitely took time. And like there's different components. So we have like clinical, we'd have like on campus we have like the sim lab, which has like all of the mannequins and stuff like that. Or we like actually run through, like we just did a code blue situation, and that was really cool. And like it just gets you like those experiences. They're not, you know, obviously super real, but like it makes you try to think like if you were in the actual situation. So I think those help sometimes. And then
Sometimes they like pull the actors in from the Kent State like acting program to like play the patients and like the patient families. So like they would scream at you, which prepared us, I guess, to deal with that in the real world.
Yeah. So the sim labs were good too.
But overall, and I feel like you guys feel this way too, of like, I felt so supported through the whole thing, and like professors here genuinely want to see you do the best that you can and just become good nurses. Not even just like students, but good nurses. And you know, they talk about that. Like Professor Herzog was like, you have the choice. You can either be a mediocre nurse or a great nurse. He's like, I hope you choose the latter. So.
And the clinical instructors were also really good, and I think that makes or breaks it for people. Like, if you have a bad clinical instructor, whether they just don't like teaching or they're just mean, like that's can scare us away from like being in the hospital setting. But when you have someone that loves teaching and loves showing you what to do, I think that helps a lot.
So Deiwert brought it up. That was actually my next question. I was gonna say, like, do you feel like you have like a sense of community and everything, or are there like a lot of like organizations and everything to kind of pertain to nursing?
Yeah, I feel like we're all like, I mean, there's only 120 of us now.
Okay.
I feel like we all know each other. Like we're always in the same like classes because we all have classes together, like in the one big lecture hall. And yeah, I would say that's nice.
Professors like give us their cell phone numbers, and I've texted like them numerous times asking like questions, and they always reply.
Oh, that's always good.
Yeah.
So you said the support system is like top notch, especially here
they're
at
always
Kent
there
State.
for you.
Okay, awesome. Awesome.
Even like we've talked to professors that we don't have at the time that we've had in the past, and they're always willing to still like give advice and talk to you. So.
Do they have like the option open for you, like, because you're going to your field like right now? Are you going to still communicate with your professors and friends?
You can.
Yeah.
I mean, we have our NCLEX, we have like a Kaplan course built in to like practice for NCLEX, and that professor told us that if we just reached out to her, she would like tutor us for the NCLEX, which is so nice because there's 127 of us like graduating, and she said she'll tutor all of us. Like that's so nice of her. Yeah, throw that out there. Yeah. So like, yeah, they do care about you.
So you said something about the NCLEX. How does that make you feel? Like, how does the NCLEX make you feel? Are you kind of nervous, or are you kind of prepared for it? Or
I think we're prepared. Like, I think we understand like what we need to study in order to feel okay and prepared. And we've had the whole review course built into our curriculum and stuff like that. But it's still scary. Like, this is the test that determines whether you can actually practice or not. So like, it's super important.
That's where my stress is. It's not even just the actual questions. Like she said, we've done so many practice tests and everything like that, and we know what to study. It's the actual day of it. It's a long test. It's like a stressful environment and everything. And like you said, it's like determines if we're gonna start practicing as a nurse. And,
I can imagine this.
It's stressful. And like all 4 years of everything we learn is supposed to be like all into one exam. It's like
that's like a big deal. Wow.
Yes.
Kent State has such a high passing rate though, so that makes me feel confident in our ability to pass it on the first time.
Most people do quite well when they come out of the program?
Yeah.
Okay. Awesome. Awesome. Is there anything to like kind of look forward to in the field of nursing once you transition over to your job?
I think it's just exciting in general. Like, we've been working 4 years to like reach this point to be like we're the ones that are like the nurse. Like, we're no longer the student that can go run to our nurse when something's wrong. Like, it's kind of scary, but like it's exciting too.
Awesome. So you feel kind of like you're gonna be equal now because you're on the whole program.
Yeah.
Okay, awesome. And is there like any like training required when you enter your job? Is there gonna be like a 6-week training program, or is it usually just like you jump right in?
It varies on the organization. Like mine is 12 weeks orientation.
Okay.
So
Yeah, mine's 3 months.
Oh wow.
Yeah.
Mine is 18 weeks, and we also have like, do you guys do a residency too? We have like a year-long residency where like you have to go to like classes once a month until like your year is up, which like seems kind of like tedious, but I think it's nice because like I want to be the most prepared that I can be.
So they
nervous.
really prepare you for nursing. So
Yeah,
like,
they
definitely don't throw you in.
okay.
yeah.
So they want you to feel comfortable, and then kind of you build more of your skills during that, because you don't always get a bunch of practice with, you know, like IVs and stuff like that. So during that first, you know, 6 weeks, 3 months, whatever, you really get to take the role of the nurse and practice your like clinical skills
with someone watching you and like
Yeah.
backing you
Yeah.
up, so you're not so nervous.
right.
Okay. That's awesome. So I wanted to ask you, it's kind of a sensitive and personal question, but when did your like passion for nursing start? You don't have to answer this if you don't want to, but like, do you remember like when you first became interested in nursing, and like what kind of inspired you to go into
Me,
it?
it wasn't something I've wanted to do forever at all. It was more, I've always liked working with kids, and I wasn't sure if I'd want to be like a teacher or like just something to where like I could work with the like children population. And then as I got older and more in high school, like it just kind of stood out, and it was something I wanted to do.
Okay.
Well, my mom's a nurse, and I was like, that sounds pretty good. And then I really grunge, like really like it, so I'm happy I chose that route. Yeah.
I always wanted to be a teacher, like going off what Courtney said. And then in high school, I shadowed my cousin who was a nurse, and like I fell in love with it like right then and there, like sophomore year of high school.
Okay.
And then I just stuck with it.
Awesome. And I'm so glad to see you being actual nurses now. We're gonna just say that you're nurses because pretty much you're gone. You get
We're almost there.
So that's so exciting and everything. And do you have any advice for like, because I know you don't know this yet, but like once you get done everything, do you have any advice for hitting the ground running? Do you have to like make a lot of lifestyle changes, like changing apartments or anything, or is it gonna be like, is life gonna stay consistent?
See,
Yours will be big.
Yeah, I'm gonna be moving to Columbus and like getting an apartment, but I also like I lived in Stowe, like close to Kent, and so when I like moving to Kent wasn't that big of a deal. It wasn't like a big change, but so I don't even have any advice like for myself. Like I'm just looking at apartments now and just kind of like taking it day by day.
Okay.
It's more exciting than like stressful right now, at least. Not too stressful.
I mean, I'm moving back to my parents for like a year, so that'll be interesting. But because I want to save up during that year to buy a house after.
Okay.
But I don't think it'll be too bad because, like you said, Kent and Stowe are really close, so like it's not that big of a deal.
I'm moving back home as well, so
Okay.
it won't be that drastic for me.
And like with planning, do you see your like yourself establishing like a family, or do you want to kind of just focus on your field, or like, I know that's another personal question, I apologize for that, ladies, but do you think it's a compatible field with establishing a family?
Yes.
Yeah.
Especially only working 3 days a week is very nice. Like for that. And then even if you were to go like into your like practice like further on, which I would want to do before I was like having a family yet.
Okay.
You could be an NP in like a doctor's office and work normal hours if you wanted that. So that would be even more compatible with having like kids and like being married and stuff like that.
Yeah.
I want to focus on getting my NP before like starting a family for sure.
Okay, so you're pretty passionate.
Yeah,
focused
like,
on the field. Okay.
yes, yeah.
Okay, so
For me
before
personally.
anything else, you ladies have to take care of business,
Yes.
get everything established, and okay.
Yeah.
Awesome. Okay. I definitely want to incorporate that because I know a lot of people might already have families who are watching this video and everything. They might want to establish a family right after. So.
Yeah.
Which is also both doable. Like
It's doable?
my mom had 2 kids during nursing school.
Oh wow.
And then she started her first job, and she was having me, like, and she's fine. She made it. So,
Okay, awesome.
Like, a lot of nurses do have a lot of kids and stuff like that, so it's totally doable either way. I mean, it's just, you gotta make it work for you, and you'll figure it out along the way.
Okay, awesome. And so you were telling me about like further growth and everything within the field. Is there like a limit to growing, or is it is there like so like you would get like your PhD, and is that like the end, or can you still grow after receiving your PhD? or your master's or your bachelor's?
You can keep growing.
Yeah.
Honestly.
Keep growing?
You can just keep getting, I mean, if you want to keep just getting more and more degrees, like there's just more and more things you can do. So I think that's one of my favorite things about nursing in general is like we won't have to stay where we start out.
Okay. And you were saying it's like a very flexible field, so you can just like, you can work in med surg and you can just switch over to like respiratory if you wanted to, or like cardiac, or like with no, like, is there like any hurdles or anything, or is it just?
I think in general, they make you, at least where I work, you need to work on the floor that you're at for like 9 months before you switch specialties. But there are some training, like if you go from med surg to ICU, there's obviously differences and you need to learn like kind of equipment and that kind of stuff. I mean, with every specialty, there's training involved, but nothing you can't do while you're like working. Like nothing prohibits you from going from specialty to specialty.
Okay. Awesome. Is there any experiences you ladies would like to share to our audience or to me? Like any experiences that you like were kind of unique to your nursing experience?
I would just say like advice-wise, I guess, is like there were times when we would go, or at least me personally, I would go to like clinical and have like a bad, like terrifying day at clinical, and like just not to let that stop you from like continuing, because there were times like we've had mean patients and like we weren't used to it, but like that's gonna happen, and like it's just something that you like get over and like learn how to react to better.
I also think too, if you're in nursing school and you can have like a tech job. I had a tech job where I'm working now, and that helps you feel like exponentially more comfortable in a hospital environment. Like you're not afraid to just go in and talk to patients, and you just get a better idea of the flow and everything like that, and just being submerged in that environment really helps. So I would definitely recommend that to anyone.
I think going with like Courtney, I'm sensitive, and like I've had patients just be like, I don't want a student today, like get out, and like you just can't take that personally. Like they're feeling at their worst in the hospital. And
Okay, so that's a big topic in healthcare in general, like having mean patients. Was it kind of hard to adapt to that lifestyle of having that mean person when you walk in the room? Or?
I think it was, I guess I think I wasn't expecting it. So when it was happening a lot, I think, it was hard to adapt to. But like I also have a tech job, so I saw that throughout like other days that weren't just clinical, and I think I learned how to like react to that then a lot.
And I think it's always important to remember, like, it's not really about you, it's about them. So understanding maybe why they're upset and getting to the core of that, and remembering like why you're in this field is to help people. And you know, sometimes it's hard, you know, when it doesn't seem like they want your help or anything like that, but you learn how to, you know, navigate that kind of situation.
I think having my friend come on a psych floor like really helped me with that. Like I got things thrown at me, screamed at, like, and I don't know, I guess like going off you, like communication is key. Sometimes they can't communicate what they need, and if you just listen to them, they're able to express it and you can help them that way.
Perfect. Okay, next topic I want to get into is kind of like the most important topic for nursing students or prospective nursing students and nurses. How do you like manage stress within like a situation like nursing? Like how does that, do you do like exercising, or do you like, is there any factors that kind of
I feel like
help you out
in general, just making sure that you take your time for yourself, like whether it be like you like to work out, so like you have a scheduled time each day that you like say, okay, I'm done studying, or I'm done like worrying about this and I'm gonna go do that. Whatever makes you like relax, whether it's that or like reading a book or anything that you like to do, I would make sure you try to schedule time for that.
And I feel like I didn't learn how important taking time for yourself and having good like coping mechanisms was until maybe the end of junior year. So like if you can figure that out earlier, the better. But yeah, I mean, I think it's figuring out what makes you actually feel better. Like I should probably work out, but I don't. But it's just like I like to, I don't know, just hang out with the dog, or you know, just relax, take a nap, like paint your nails, something relaxing that you can just kind of forget about the stress.
I used to like push off, like I can't work out today, like I have to be in the library for 12 hours, but like you can take 30 minutes for yourself and just do whatever's going to make you feel better.
Okay, so I want to actually incorporate something into your conversation. Do you think like social support is a very, very important factor in relieving that stress and everything. Like, because I know you were saying something about community and everything, and you're relying on your classmates and instructors. Do you feel like that was like a huge like percentage of you getting better and getting through the program? Were you able to leave a patient's room and kind of go to a nurse or physician or whatever and kind of express that? Do you feel like there was openness in that?
Yeah, I feel like everyone throughout the whole program was pretty helpful with that. Like if you wanted to talk to like a nurse or like specifically your clinical instructor, like they would be there for support throughout.
And I think too, just in general, dealing with the stress of nursing, we all live together. So surrounding yourself with nursing people that kind of understand what you're going through is really, really helpful. Yeah.
I think people not in nursing sometimes don't understand how stressful it is. Like even my mom would be like, you can take a break, like it's okay, but like you don't feel that way yourself. But like they could understand like how stressed I was feeling. Like we have 2 exams this week.
Yeah.
So
how do you go about, because I understand that's a big problem, like your person who's not a science or nursing major or whatever will not understand that you have to study 24/7. How do you go about kind of sorting that out and letting people know? And because people get offended when you turn them down for like different opportunities.
That was a challenge.
Was that a challenge?
Yeah.
like for our non-nursing roommate, like we can't do like fun things all the time.
Yeah.
And I feel like she felt sad sometimes. Maybe she's just gonna understand. But I don't know.
You just gotta explain it the best way you can. Say, hey, I gotta study, and I think she learned as time gone on.
Yeah.
Like, oh, okay.
Yeah.
But yeah.
Okay, would you define nursing as a sacrifice to the greater good of others? Or how would you define nursing personally?
I don't think it's a sacrifice. I think I chose to do this, you know? You know, that's something actually came up at work the other day about a patient was like, I'm so sorry that you have to do this, but it's like, no, like I chose to do this, and like this is what I like to do. Like, I don't know. I just think, I don't know, it's not a sacrifice. It's what I want to be doing.
Okay.
I think that is what separates like average nurses from like really good nurses, is the ones that like want to be helping. Like there are some that go into it and I don't really know why, but they don't really even like working or like helping the patients when they're like in that time of need. And like the really great nurses, you can tell, do. Like they want to be there and they want to help people out.
Having a passion for it definitely does not make it seem like a sacrifice to be there helping patients.
So the patient is everything to you ladies in nursing?
Oh, yeah.
Awesome. Awesome.
I think like when we start working, being there 12 hours, we'll be able to build like a better relationship with the patient versus at clinical when we weren't in there for that long. Like at practicum, like going in 3 days a week, like the same patients would be there and they would know you then. So that was really like cool to see that for the first time.
Is this done in like a group setting, or are you kind of taken individually?
For practicum?
Yeah.
It's individual.
Oh, it's individual?
One-on-one with a nurse, like an RN. So we all got paired up on like different units.
And was that a big time change from like the group clinical rotations?
Yeah.
Was that like, was that kind of scary?
Yeah.
It was good though, because I feel like beforehand I wasn't super comfortable in hospital, but we spent 144 hours like one-on-one with a nurse, and like most of the nurses I feel like let you do your own thing. Like mine wasn't even, half the time was never with me. She just was making sure I wasn't making a mistake.
Okay.
So it felt very like I felt on my own and more independent, which is what I needed personally before graduating, so I didn't feel like incompetent.
Okay. Is that like a usual feeling after you get done, like that you have no clue what's going on? That's
Yeah. Oh yeah.
Okay. So like you shouldn't feel different when you feel like you finished up, you went through all this hard work and everything. You're like
all nurses say that.
Okay.
Yeah.
So it's kind of like learn as you go.
Yeah.
Once you
And
get in
they
there?
say that. I mean, obviously you have the knowledge base to like critically think, but maybe you don't have some of the skills and all that kind of stuff. But they say that the first like 6 months to a year is where you're going to learn the majority of everything. And like that, if you go into a different like med surg, like I'll learn more and more in depth about that, and then you'll do more and more about peds. So you just build on it, and like I think they say that the first 6 months to a year is really scary, but I mean you make it through, you learn what you need to learn, and it's all gonna be okay.
Okay, I'm gonna ask a long-term question. So like, where do you see yourself in like 10 years from now with nursing and everything?
Okay, career-wise, I would like to see myself have finished up with my like advanced degree and working as an advanced degree job. I don't know exactly yet. Like I'm looking at like a pediatric NP, or like I was saying like a nurse educator, maybe doing clinicals and everything. hopefully having a family and all that.
Okay.
Pretty much the same. I hope to have been done with, I either want to be a geriatric nurse practitioner or psychiatric. So finishing up that and yeah, just practicing.
Same. I mean, like, I want to either be a family nurse practitioner or women's health. So hopefully that will be done in 10 years.
Okay, perfect, perfect. Big dreams and everything, big goals. Keep striving for them, of course. Is there anything else you want to share before we wrap up the video, or?
It's all gonna be okay.
It's all gonna be okay?
Anyone can do it. If you have the passion for it, for sure. It's doable.
Put the effort in.
Yeah.
Okay. So you have to commit. Do you have to commit every single week, or can you take a few weeks off? Is that possible in nursing?
Not a few weeks.
Not a few weeks.
Not a few weeks.
A couple days.
A couple
A
days.
couple days?
Yeah.
It's possible to take a couple of days off?
We've had breaks, like when we haven't had exams. So
Yeah.
yeah, you can take a few days for yourself.
Okay. And I wanted to ask, do you get the opportunity to see your families very often with this program, or is it just kind of...
It is very depending on the semester. Like I said, the junior year, just the whole year in general was very stressful. But like after that, our senior year, I feel like we were the most free we've ever been.
Yeah.
Like it's very nice. You can go do things like that you like to do if you want to see your family or like hang out with friends more often. Definitely, like towards the end, senior year is much better than previous.
Okay. So you would say friends and family is still there? Because
Yes.
I know a lot of fields will take that away, unfortunately. But okay, so there's a nice even balance in life, social, family, and studying and everything for nursing students.
I think it's like important to keep that balance, to keep yourself sane.
Yeah.
Like throughout the program.
But you have to make it a priority
Yeah.
to keep all of that, you know, all of those equal. If you want to see your family, you make that a priority and say, hey, you know, I'm going to go spend 4 hours here. I can study after. Like, it's not that big of a deal.
Yeah.
It's making time for the things that are important to you.
Okay. So you got it. You're all pretty much, each and every one of you ladies in the program are independent individuals who decide what route to kind of take.
Yeah.
Is that how it works?
Yeah.
So it's up to you. So you come
Yes.
into the program, you're like, oh, I'm going to see my family this amount of time. I'm going to work this job. I'm going to do this. I'm going to do that. Okay.
For sure.
It's very personalized based on your lifestyle, I think, and what else is going on in your life.
Awesome. All right, ladies, thank you so much for this interview today. I
Thank
really
you.
appreciate having you and
Of
everything.
course.
Thanks for
It's
having
been
us.
excellent. So I'm Jonathan again, and thank you so much.
Thank you.